Hi, today is Wednesday, March 13th, 2024, and this article is from Yahoo Life, and what was written by CNN. The author is Melanie Radzicki McManus, February 18th, 2024. It's a 6-minute read. It will be about a 20-minute read for me because I'm Korean. I work for Korea Telecom, KT, the number one carrier in Korea. So I'm not a native speaker, but I'm trying to be. So here we go. CNN, gait speed is one of your vital signs, so make sure yours is okay. Gait speed. Sign up for CNN's Fitness But Better newsletter series. Our 7-part guide will help you ease into a healthy routine backed by experts. The exaggerated strut of a runway model is a far cry from our regular folks' walk. Yet everyone moves in a unique fashion, and your personal gait can indicate a lot about your overall constitution. Gait is the way in which you walk. While everyone's gait differs, you may develop an abnormal gait due to illness, injury, genetics, or issues with your legs or feet. Abnormal gaits are characterized by irregular movements such as dragging your feet, waddling, or crossing your legs as you walk. Waddling, right? What happened? What happened, man? What happened? I'm using a Galaxy S24 Ultra, 512 GB. Abnormal gaits are characterized by irregular movements such as dragging your feet, waddling, right, shaking your legs, waddling or crossing your legs as you walk. Your walking speed can also be an indicator of your health. In fact, it's gaining traction as one of your vital signs, along with body temperature, pulse rate, respiration rate, blood pressure, and oxygen saturation. Vital signs provide critical information to assess and predict your health and to allow proactive intervention to keep you as safe and healthy as possible. Here's why getting your gait analyzed by a health professional could be beneficial to you, according to experts. What a gait analysis can uncover about your health. Assessing gait can predict gross motor delays in kids, fall risks in older adults, and when coupled with a cognition decline, the risk of dementia, cognition decline, fall risks, motor delays, gross motor delays. In addition, a slow gait may be a sign of a premature mortality, cardiovascular disease, or cancer. According to a July 2018 meta-analysis published in the Journal of the American Medical Directors Association, the meta-analysis covered 44 studies with a combined 1,945 participants. Gait analysis for fitness and sports performance. When it comes to sports and fitness, gait analysis can indicate your likelihood of injury, mechanical issues that should be addressed, and the time you will be ready to resume an activity after an injury or surgery. For people who have certain injuries, a gait analysis can help us correct the mechanics that might cause it to recur, said Dr. Brian Heidersheit, a professor in orthopedics at the University of Wisconsin-Madison and director of Bachelor Athletic Performance in Medicine. These injuries are often related to bone stress, knee pain, hip pain, and Achilles tendinopathy, he said. The latter is a painful condition in the Achilles tendon, often caused by overuse. A professional analysis can also indicate inefficiencies in your movement that, when addressed, can improve your running speed, pickleball playing, and even your golf swing. Experts said pickleball. I think pickleball is more like a ping pong ball, but it uses a tennis ball, and the racket is oversized ping pong ball, and you play on the net, play on the tennis ball playground court. So basically, it's a combination or confusion or a conversion of table tennis and ping pong game. That's what I think, right? Pickleball. I think I've searched that sport twice. Experts said, but be prepared to do some work post-analysis. Your gait isn't something that can be corrected instantly. Heidersheit said, it's not as simple as saying walk differently. You may be walking a certain way because one calf muscle is half the size of the other one, and the only way to correct that is to focus on certain exercises, calf muscle. The evolution of gait analysis. Health professionals analyze gait in different ways, and the type of analysis best for you will depend upon the issue you are trying to address. Some analyses are as simple as having a trained professional, or often a physical therapist, watch you stand up from a seated position, walk a certain distance, and return to your seat, Heidersheit said. The professional will measure the quality of your movement and the time it takes. Other adults are often given 6 minutes to walk as far as they can. Clinical labs such as Heiderscheit's are equipped with treadmills connected to cameras and sensors which capture and recreate your movements, but some patients are sent outside to run with the sensors attached, especially if they have issues with sprinting or changing directions while running. More recently, artificial intelligence also is keeping tabs on people's gaits. One example, keeping tabs on people's gait. That's good. Keeping tabs on people's gaits. Keeping tabs on people's gaits, right? More recently, artificial intelligence also is keeping tabs on people's gaits. One example is OneStep, a digital health platform that healthcare professionals can use with their patients. The patients download the OneStep app to their phone, then put their phone in their pocket. The app continuously tracks their movement, which their healthcare providers can easily review. We are looking at gait speed, cadence, the number of steps per minute, variability in gait speed and cadence. Cadence, the number of steps per minute. Step length, the time both feet are spent on the ground, stance, and more, said Stephanie Wakeman, a physical therapist and OneStep's director of clinical operations. In addition to allowing healthcare professionals track how a person's recovery or physical therapy is progressing, the U.S. Food and Drug Administration listed device can alert them to other potentially serious issues. Wakeman said, if someone has a very slow gait speed, but their cadence is very high, their steps are very short, and their double support time is very high, that combination can suggest a shuffling gait, which is associated with Parkinson's disease. Wakeman said, is not an absolute predictor, but it can raise a flag for a clinician. A patient had been faithfully using one step, plus doing some exercises her physical therapist requested. When her therapist noticed her walking speed and exercise sessions abruptly declined, Wakeman said. The therapist reached out to make sure she was all right and discovered she was depressed following a close friend's death. So the physical therapist got her connected with someone to talk to about her grief. Wakeman said, grief. The therapist was doing a real good job of keeping tabs on this patient, right? That's just one example of how this can help. So the physical therapist got her connected with someone to talk to about her grief, Wakeman said. He got her an intervention that she may not have had otherwise. When to have your gait analyzed. If you have an injury or pain that you suspect may be connected to your gait, it may be helpful to schedule a gait analysis with a physical therapist, as they are experts in body movement problems. In general, insurance should cover the cost. But if you're interested in the gait analysis to boost your athletic performance or prevent injury, you may have to pay out of pocket. These analyses can cost $100 or more, depending on the session length, equipment used, and other variables. Even if you have to pay for an analysis, it may be worth it. Work this way. Whether you are a seasoned athlete or recreational walker, both Heiderscheit and Wakeman said it would be great if everyone's gait was regularly analyzed and if all healthcare professionals paid attention to the patient's gaits. I would also love it if your gait analysis was part of the recovery program for anybody who has knee, ankle, and hip surgery. Heiderscheit said, we'll see it become more mainstream because the technology is rapidly advancing. We will see it become more mainstream, becoming more mainstream, we'll see it become more mainstream. Mobility is a sort of the fountain of youth, Wakeman said. If we want to maintain a healthy, good quality of life, we have to be very concerned with our mobility. Melanie Redzicki McManus is a freelance writer who specializes in hiking, travel, and fitness. For more CNN news and newsletters, create an account at CNN.com. View comments. Should I? Why you can trust us? From this article, I learned these expressions. Keep tabs on people, gaits. Out of pocket, we have to pay out of pocket, not from the insurance company, right? Out of pocket. Keep tabs on. What else? Cadence, right? I was with the U.S. Army for 2.5 years. So 1, 2, 3, 4, 3, 4, 2, 1. Right? Left, right, left, right, left, right, left. Left, right, left, right, left, right, left. Right? Evolution, different ways. Achilles. Well, just analyze your gait and keep up the cadence, and it will become more mainstream, right? More mainstream, and you will stay in healthy. If you have a grief, please find someone to talk to and be happy, and don't rely on medicine. Rely on Korean medicine. Korean medicine is Oriental medicine. You can come and have massage and acupuncture, herbal medicine, prescription cheap, and the rest of the time you can venture into the Korea wilds, or you can mingle with the local people to enjoy the culture, food, and maybe you can make money by teaching English on the side, right? Korean people, they are very eager to learn English. You can have your free talking class set up. I can help you. Have a wonderful Wednesday, and enjoy. Bye-bye.